The next on my list is Alam from the University of Oslo. I'm not sure if he was the one who said he would not going to speak. Is Alam here? Yes. Yes.
Hello. Hi, I'm Alam from University of Oslo. I was probably the first man in this forum because I was in charge to help women in their delivering process when I was in my fieldwork in Indonesia. And then my question is that maternity issue is not only addressed to the state and also the policymaker, but it should be also responsible of a man or the husband, because they are the closest person or the closest individual who get in touch with the wife when they are going to give birth. So according to your own experience when you're in the Mozambique and also according to the WHO policy, is there any simple methods or easiest way for man or husband to help their first construction of women before send out to hospital? Thank you.
Yeah, I think in the Western world, of course, they have preconception care and the antenatal care, and in that they prepare the husband as well in many ways to support the wife, which is not well developed in the countries where the healthcare has not developed to a greater extent. But there is an opportunity for them to learn and to be with them, and many of the men feel very shy to go with the woman to the hospital. In many cases we find they come because the woman has not born a child before, we call infertility problems. Sometimes the husband doesn't turn up, but you have to examine both in order to find, because 30–40% is due to male issues. So it's a matter of building the society so the male partner also takes active involvement in looking after the nutrition of the mother-to-be, and also to learn about what are the symptoms like bleeding or pain or headache, where he has to bring the woman to the hospital as soon as possible. So community education is quite an important one. So what you have stressed is actually community education, so the husband also plays an important role, which has to be part and parcel if you are going to reduce maternal mortality and improve women's health. So thank you for that question. I think it's quite an important one. Bert, if I may just take the previous one, which I missed because of the minister, the question from Spain. I think every one of us in the humanity must live with hope. You mentioned there was the MDGs have not achieved, which is not true. The maternal mortality has fallen from 535 to nearly 350,000, but the decline is only about 1.5%. Actual decline, if you want to reach the goal, is about 5%. So there is a gap, but there is still hope. Whereas if you're talking about child mortality, it has gone down tremendously with measles vaccination and so on. So I think we must have the desire, the determination and devotion to do that. So as long as we all work together, I'm sure we'll be able to achieve, at least not completely, but to somewhat trying to achieve the MDGs.
Can I just say that I think this is a long-term activity. In my own country, Sweden, a couple of decades back, or let's say 60 years back, fathers were not at all involved in women's business, and that had to do with poverty and lack of resources, like in many countries in Africa today. If you don't have any privacy when you give birth, it's very difficult to have men involved in this business. And culturally, women are typically involved in that, but there are also male TBAs, male traditional birth attendants. Actually, in some West African countries, they have males as traditional birth attendants, and we have male midwives in some African countries also. So males are involved, but this is a long-term educational process of partnership, and I think we need, and that is easy to say, but I think we need role models, men being capable of showing that they are part and parcel of a pregnancy, and they are sharing the pregnancy worries, the pregnancy pain, the pregnancy problems, and the responsibility of the outcome of pregnancy with the mother. That is very important, but that is a long-term goal. It has to do with male health education.
The next on my list is Eivind Rindal.
Good evening. I have one question. It's about the tricky fields of religion and tradition, and of course the health of women. It's about abortion. And the question is, what can we as students, activists, and citizens do to change anti-abortion laws that are a threat to women's health in also developed countries like Ireland? EU member Ireland don't allow women with cancer to get a proper treatment because of their anti-abortion laws. So what can we really do?
I would like to tell you that one good argument, long term, we are not legal lawmakers, but we can tell from our own experience, and you can tell the people. I used to say one thing: if you are against legal abortion, you are in favor of illegal abortion. Did you get that? If you are against legal abortion, you are in favor of illegal abortion. And that simple knowledge, you can tell people that, because I happen to know that in countries with very restrictive abortion laws, Uganda is one typical example. If you take the number of abortions per 1,000 women per year in Uganda, that is higher than in Denmark, which has completely legal abortion, which says that irrespective of legalization or criminalization or campaigns against abortion, women will interrupt pregnancy when they have decided to do so. That is the simple rule. That is a fact, and you can see it in many countries. So we cannot counteract abortion by making it illegal. It will happen anyway. It will go on, but underground, and kill women. And 15% of all maternal deaths in the world, 15% of that 500,000 are due to lack of choice, lack of freedom to do what they absolutely have decided to do, that is to terminate the pregnancy. Whether we want it or not, we cannot say that I'm religious, I'm Christian, I'm Catholic. That doesn't do for health workers now. We must take the professional responsibility, saying that if you are against legal abortion, you are in favor of illegal abortion.
Yeah, coming to change in the laws, there are a lot of activities going on speaking to governments by public bodies. In Figo, for example, many years ago, or within the last 10 years, the abortion laws in Nepal was changed following a case where a girl was sent to the prison. After being raped, she got sent to the prison, and international bodies pressurized in order to procure abortion. So there are 54 countries where we are working, and we know that South America is one of the major cause of maternal deaths is abortion. So I think we have to keep on working. It's not very easy, as you say, because of religious reasons and other reasons. And as Staffan has mentioned, the mere fact is actually the deaths will continue till such time we can make it legal. But also we have to remember, in most of these countries where it is not permitted, we have to step up the use of contraception in some way so that we can really make a change. And with future medical abortions coming in with the tablets, I'm sure things will change for better or the worse to help as many women as possible.
Maybe it should also be added that actually if we look at the whole world, it is getting better in terms of abortion legislation. It's going slowly, and there are those countries that make their abortion laws more strict, but those are few compared to those who liberalize their abortion laws. And I think since Since this is a students' festival, I think also we should stress the importance of research, of knowledge. There is this, as was said, strong religious meanings about this, but showing that women do take abortions. Once they have decided this is an unwanted pregnancy, most of them will terminate the pregnancy regardless of the law, regardless of whether it can be done safely or unsafely, and far too many die. But actually the world is progressing slowly, slowly. There is this tendency to think that in this country, in this village, in this town, all pregnancies are wanted and all children are wanted. But, you know, the neighbors, all these others, it's this othering thing, you know, that others have their immorality, but we are the decent ones. We don't do that sort of thing. So to show that it's actually happening everywhere and that the results are disastrous, which is also a religious and moral issue. I think we tend to talk about values as norms only, but actually the consequences of actions also has moral bearing. The next on my list is Basiri.
Hi, my name is Basiri, but my question was for the Minister of Foreign Affairs. Sorry.